All right, let's go ahead and begin. Welcome to today's webinar. Thank you so much for joining us. My name is Reem Tariq, and I am a Senior Project Coordinator at the National Environmental Health Association. I'm also serving as the Lead Administrator for the Private Water Network. I apologize. I am actually quite not well today. So if I do sound a bit off, just know that's why. So for this webinar series, it's under the guidance of Rural Community Assistance Partnership, RCAP, that the National Environmental Health Association is hosting a 5-part webinar series on private well and groundwater monitoring surveillance methodologies, emerging treatment technologies, as well as appropriate risk communication strategies on private well testing. This webinar series provides a much needed, easy to access information and training on domestic well water quality and safety at no cost to environmental health professionals. Before we delve into the details of today's webinar, there are a few things that I'd like to address. Since the topic area for this webinar series is on private wells, there is an important resource that the National Environmental Health Association hosts that I'd like to make you folks aware of, and that is the Private Water Network. If you're not a member of the private water network and are curious about learning about what the network has to offer, then let me inform you that the network is a virtual community of public health professionals and safety workers that work with private drinking water systems. The network was launched by NIHA in partnership with the CDC, as well as the National Network of Public Health Institutes. The mission of the private water network is to build a sustainable community for those working to support private water programs, to connect with their peers, to share experiences, insights, and resources, and to gain access to timely and relevant guidance for existing as well as emerging issues. Lastly, we also help to build capacity for the professionals that are part of our network to do the work more effectively as well as efficiently. Membership to the network offers access to a virtual community platform that has many features that are typical to online communities, such as a discussion forum, a resources library, an events calendar, as well as a member directory. Please note that this is a free resource to anybody who works with private drinking water systems and anyone who is curious to join. If you would like to access the private water network, you can do so by putting in the link www.pwn.niha.org. And again, I will drop the link in the chat of this webinar. Now, on to our webinar. Um, Today, we will be exploring a webinar that talks about mental models approach to risk communication to design an intervention that would increase private well water quality testing in peri-urban neighborhoods without water service. This approach gathers data on beliefs and knowledge of target population, compares them to expert knowledge, and designs the risk communication to include the most prevalent knowledge gaps and misconceptions that are also the most decision relevant ones. The speaker for today's webinar is Dr. Jacqueline McDonald. Dr. Jacqueline McDonald recently joined the Indiana University of Public Health as the chair of the Department of Environmental and Occupational Health. Previously, she was a professor of environmental sciences and engineering at the Gilling School of Global Public Health, University of North Carolina at Chapel Hill. She conducts research to quantify environmental impacts on population health in order to support environmental policy decisions. Her recent research has focused on assessing racial disparities in access to treated municipal drinking water in North Carolina and the impacts of those disparities on health, a project initiated at the request of former North Carolina Director of Public Health. Her prior research has included projects to advise the City of Raleigh on health impacts of alternative designs for urban neighborhoods, and to advise Environment Agency Abu Dhabi on prioritizing environmental policy initiatives to maximize public health benefits. Her recent theoretical work focuses on using machine learning methods to uncover complex interactions between environmental factors and public health. Prior to joining University of North Carolina faculty, Dr. McDonald Gibson served as the Associate Director of National Research Council's Water Science and Technology Board and Senior Engineer at the Iran Corporation, a public policy think tank. She received her BA in mathematics from Bryn Mawr College, a master's in environmental science and in civil engineering from the Department of Civil Environmental Engineering at University of Illinois at Urbana-Champaign, a PhD in engineering and public policy from Carnegie Mellon University, and a PhD in civil and environmental engineering from Carnegie Mellon University as well. Her doctoral studies were funded by the National Science Foundation Graduate Research Fellowship. She has 3 sons and 2 stepsons and enjoys running marathons as a hobby. Dr. McDonald, thank you so much for joining us. Uh, Before I pass it on to you, I just want to cover some quick housekeeping rules before we begin. The session is being recorded. The recording to the session will be uploaded onto the NIHA LMS once the entire webinar series is completed. We will also share any links and resources that are shared on this webinar onto the NIHA LMS, as part of a follow-up email for anyone who might have missed today's webinar but was registered for it. Please use the Q&A box to drop any questions at any point during this webinar, and we'll take all questions towards the end. At the conclusion of the session, you will be directed towards a short evaluation survey. Please to take the survey because it does help us in improving the future offerings. And with that, Dr. McDonald, I'll pass it on to you to share your screen.
Okay, thank you so much for the nice introduction, Reem. I'm going to need access to the screen sharing.
Absolutely. Let me go ahead and do that. Try that now, please.
Okay, perfect. All right. Hopefully that is working.
Mm-hmm.
I'm so glad to see so many people on today. I wish I could see your faces. I see a few names I know on the list, but I wish we could meet in person, but I guess this is the next best thing. So as Reem mentioned, I'm going to be talking about a risk communication strategy for encouraging households relying on private wells to get a water test. And in this work, I've used an approach that really comes out of the field of behavioral psychology, and it's called the mental models approach. So today I'm going to tell you, so this work has really occurred with a specific target audience of private well owners in mind, but I really think that our findings are broadly applicable for any type of private well owner. But I want to tell you a little bit about that audience and what's a bit different about it compared to private well owners that may be more common in certain areas. So I'll talk about our objective, which was again to design and actually test a risk communication to see if it works. And then I'll give you a little bit of information about this approach from behavioral psychology that we've used, the mental models approach, and tell you about our randomized control trial, and then what we found about the impacts of this communication on decisions to get a water test, and also on knowledge and beliefs about private well water. So just to begin with a little bit of background, again, usually when we think private well, we think a very rural area. I see a hand raised. I'm not sure, Reem, how you want me to handle that, but
We can take the questions towards the end.
Okay, great. So I'll take questions at the end. Terrific. Okay, so this particular, normally when you think of private well owners, you kind of think of households out in rural areas, and while certainly most private wells are in rural areas and areas where it really doesn't make economic sense to extend municipal water supplies because houses are so far apart. I've been working with a particular kind of private well community for about the last 10 years. And these are communities that are in historically African-American neighborhoods, specifically in North Carolina, but these exist in many other states as well, that are just beyond municipal boundaries and therefore typically not connected to the municipal infrastructure. So this is actually an illustration of a community that I've worked with, just to show you what this looks like. This is a neighborhood that's adjacent to a city in North Carolina. And this neighborhood, the dark orange, means that this neighborhood is almost 100% African-American compared to the surrounding areas, which are majority white areas. And you can see these are the municipal water lines for the town, and they end right here at the entrance to this neighborhood. So these are all property parcels. And again, this is sort of a little different from what you might be used to seeing with regard to private wells, in that, you can see these properties are close together, and every one of these property parcels has a private well and also a septic system. And some of the septic systems aren't performing very well. There's a lot of problems with overflows. The soil doesn't perk very well. So that's kind of, public health 101 would suggest that we don't really want private wells in close proximity to failing septic systems, and particularly to a high density of failing septic systems. So, but what I've really found in my work is awareness of potential risks to water quality in these communities can be kind of very low. I'll talk about why, just for a moment, why do these communities exist? This is a bit like the phenomenon of redlining that's been in the news lately. Although redlining is now illegal, it leaves a kind of a long shadow. And many of these communities were located in these areas just outside of municipal boundaries, really dating back to the Reconstruction era after the Civil War. And there was a concerted effort to keep them outside of town boundaries, to kind of keep the white balance of power in town. And of course, although none of this is legal anymore, there is this long shadow. And so again, what makes these communities different in some ways is that they're close to infrastructure. It might make economic sense to extend that infrastructure, and there's a relatively high density of housing. My students and I, about 10 years ago, again, we began to look into these areas to see what water quality conditions looked like. And we found a high prevalence of lead and some other contaminants as well. So this is some data from some of our preliminary early lead testing work, where we found that about 28% of houses had lead above the EPA technology-based action level of 15 parts per billion. So this is just a histogram, showing here about 28% of the houses we tested had lead above this threshold, including one with very high levels of lead. And this was in the kitchen tap water. And I just wanted to point out that during the Flint water crisis, not all of the houses in Flint were affected, and the prevalence of elevated lead in kitchen tap water was similar to what we see in these neighborhoods. What my students and I also found through surveys is that residents of these communities really were largely unaware of the risks of contamination. So in a survey of 76 heads of household relying on private wells in these communities, 60% answered no to the question, my well water may be contaminated with lead. Only a very small percentage answered yes. The rest thought maybe or didn't know. So really there's a low awareness here. We also found from this same survey that, that compliance with state guidelines for water testing was really low. So the state of North Carolina has recommended frequencies of well water testing for various contaminants. Of course, there's annual testing recommended for microbial contaminants, lead testing every 2 years. And what you can see is that, most folks were not testing their well water every year or 2 years. The largest group really weren't sure when the last time was that they tested their well. Another large group had never tested many hadn't tested for 5 years. So this is very consistent with what's been found in surveys of rural private wells as well. Oops. So, I began to think, okay, what are some solutions to this problem of increased risks of exposure to certain contaminants in these communities? One is to raise awareness of the problem through increased water testing. Of course, that won't solve the water quality problems in these communities, because if a household discovers there's contamination present, they still need an intervention. But this, increasing testing at least could raise awareness, maybe leading eventually to some support for these communities to manage their water quality problems. And just, I've done some research with students in the past where we've actually gone around and interviewed water utility personnel and mayors and other leaders in towns that are adjacent to some of these communities I'm talking about here. And we talked to people in areas where there were many such communities that were still disconnected from the infrastructure, as well as in one community that had recently made the decision to connect one of these African-American neighborhoods to its water supply infrastructure. And this town official said, this is just a quote from some of our interviews, "I think the health director is saying this is a community health hazard. That means you've got to take care of it." And that ended the argument. So again, this is part of awareness raising, not just amongst the well owners themselves, but also amongst policymakers who might be in a position to provide support for these communities. So our objective with this part of the work was to develop an evidence-based risk communication to promote water quality testing in these communities. And I say evidence-based because sometimes our best ideas about how to communicate risks might not be what the community needs. So we really want to develop something that works. And so I'll talk about the method that we used next. And really the method that we used, again, comes out of cognitive psychology, and it's called the mental models approach to risk communication. And the basic idea of it is that risk communication should really support decision-making by lay people. So risk communication means communication intended to supply lay people with information they need to make informed, independent judgments about risks to health, safety, and the environment, right? That's the goal with risk communication. We don't want to talk to experts. We really want to talk to lay people and help them basically receive and digest and act on the information they need to protect their health. This is a quote on this approach from, there's a book about it called Risk Communication and Mental Models Approach. And this was, again, the basis for our work. And the problem with many efforts at risk communication is that even the most well-intentioned people often use messages that aren't really effective for changing behavior. So rather, what experts tend to do when they set out to try to inform a lay audience about risks is that rather than conduct a systematic analysis of what the public believes and what information they need to make the decisions they face, communicators typically ask technical experts what they think people should be told. So we think about sort of filling brains of lay people with technical information that we think is important without first trying to understand what information people actually need to be able to make better decisions. So the mental models approach was really developed to address this limitation. It's a very systematic approach to risk communication design, and it involves 4 steps. The first step is to identify what people need to know to make more informed decisions. The second is to identify what they already know and how they make their decisions. By defining what people already know, we're sort of doing 2 things. One is making sure we don't waste our kind of precious real estate and risk communication messages with information that's already self-evident. Also, that we're correcting any common misperceptions that are leading people to make decisions that aren't in their best interest. And then once those steps are done, the communication content is designed. And then the last step is to see if it works and to test the effectiveness of it. So we did all of those things. And before I get into the details on this particular application, I just wanted to mention that this mental models approach has been used in a number of risk communication applications relevant to environmental health, including, and public health more generally, including communicating issues of climate change. The earliest application was trying to promote radon testing in indoor air. And there's been many other applications as well. This is just a result from a randomized controlled trial showing that this approach was effective for efforts to decrease the vulnerability of teen girls to sexually transmitted diseases. So this is basically the result of one of this randomized controlled trial, where the black bar indicates girls who were given a mental models risk communication that was delivered by video in this case. And they were asked a year after seeing the video, had they been diagnosed with an STD. And you can see in the girls that had seen the video, the self-reported result of STD diagnosis was much lower than in controls. And the girls were also tested, and those who saw the video had a lower prevalence of STDs than the girls who were in the control group. So anyway, we set out to see if this approach could work. This is a very complicated diagram, but step one in the mental models approach is to understand first what people need to know. That is to go and talk to experts and kind of map out an expert mental model of how the system or the risk that's of interest actually works. And this is a map of an expert model of private well water and how they work, how private wells work, and how private wells can become contaminated and cause people to be exposed to contaminants. So don't really need to go too much into the details, but this is based on interviews with private well experts. And there's different node shapes and outlines that just indicate that there's 4 categories of information that this mental map represents. These objects that are outlined in bold are really the main components of the water system. The ovals in gray are sources of contamination entering the water supply. The boxes here, unshaded, are system testing, maintenance, and other information about keeping systems running effectively to deliver safe water. And then these trapezoids indicate routes by which people might be exposed to water contaminants. So this is really the expert mental map. And then the next step is to identify the mental map of lay people and see where it corresponds with the mental map of experts and where it might diverge. And this is a 2-step process. The first step involves semi-structured, in-depth interviews with your audience of interest. So we did these interviews with 18 residents of the communities that we're looking into. Here's my former PhD student, Dr. Frank Stillo, really led this effort. And here he is with one of our participants. And so again, these community residents were interviewed to see how their mental models match up against the expert model. And to, again, look for areas of divergence. So in this case, the level of bolding indicates areas where it seems like the lay people have good understanding of the expert mental map. And the lighter colors and lighter areas indicate where there may be misunderstandings. And what we found, just for example, with this one is that all of the people that we talked to said that they were aware that well water should be tested regularly. But then if you go down and ask them, well, gee, what should you test for? They really didn't know. And they really didn't know about the frequency of testing. So our initial interviews with these 18 people revealed some initial concepts, some additional concepts, which was that many people believed that they could detect contaminants through sensory perceptions. That's something that did not appear in the expert model. So they really thought that contaminants can be detected through taste, smell, or appearance of the water. And this is just a quote from one of the participants. I feel like my water quality is fine as far as the human eye can see and the nose can smell and my hands can feel. Those are the only things I have, my senses. We also found that cost was a barrier to water testing for some people, not only cost of testing, but also worries about, well, what if I find something in my water? I won't be able to afford to do anything about it. So why bother testing if I can't afford to fix it? You know, ignorance is bliss kind of viewpoint. So here's another quote where a participant said, "The filter system is very costly, so we just weren't in a position to purchase it." So then the next step in the mental models approach, step 2B. So from these 18 interviews, we have an idea of where lay people might differ from experts in their mental models of what they should be doing to take care of their private water systems. And then the next step is to do a survey of a larger population of the target audience and see really how prevalent are these beliefs and misconceptions. So we surveyed, sent surveys to about 900 households in neighborhoods of Wake County, North Carolina, that are basically these areas that are near municipalities but rely on private wells. And then through statistical analysis of these survey results using something called factor analysis, we were able to identify 3 factors that really seem to be significantly associated with whether these survey respondents said they had gotten a water test or not. The first of these factors was this tendency to rely on sensory perceptions that I mentioned. That is the belief that as long as the water tastes good, smells fine, and looks clear, there's no need for a formal test. And so those that believe more strongly that they could rely on their senses were a lot less likely to get a water test. So this is just the odds ratio really showing that for every unit change on sort of the strength of this belief, the chances that people would get a water test decreased by almost 50%. Another barrier that again was consistent with what we saw in our semi-structured interviews was that concerns about cost, whether cost of water testing itself or cost of treatment, was another major barrier. So people who were more concerned about cost for every unit increase and concern about costs, these folks were much less likely to test, almost 60% less likely to test than those who were less concerned about costs. The other thing that we found that was interesting was that concerns about cost mediated the effects of lack of knowledge. So in other words, the less people knew about how to get a water test, and the less they sensed that it was really an important thing to do, the more worried they were about costs. So here in this case, this fractional estimate means more worried about costs. So if the folks who knew less were actually more worried about costs, and that's the thing that actually drove them to be unlikely to get a water test, in addition to this belief that, there's no need to test as long as the water is palatable and looks good. We also did find that folks who with older wells were slightly more likely to get a water test. So just a little bit more about these 3 barriers. Each one of these we assessed with a suite of questions, and then we combine these questions into an overall measure of people's beliefs. And just to show you what these questions look like, I'll give you some examples from the battery of questions for each of these factors. So for this sensory perceptions factor, 2 of the questions were people were asked to rate the strength to which they agree with the statement that there's no need to test my well water as long as it looks, smells, and tastes fine. There's no need to test my well water because I've been drinking it for years without problems, again, indicating that people think they should, if there's a problem, they should be able to sense it, or at least sense that maybe they've gotten sick from their water. The second category, again, was issues of how much people knew about how to get a water test and the importance or sense of urgency that they assigned to it. And again, here we asked a series of questions about the extent to which participants agreed with statements about not knowing what to test for, not knowing how to test, not having time to get a water test. And the third category was questions around cost. Again, 2 example questions. Was to ask people to rate, again, on a scale, the extent to which they agree with the statement, I couldn't afford to test my water, I couldn't afford to fix my well if I tested it and a problem were discovered. So these are these 3 factors that we found were really associated with decisions to get a water test in our population. So the next step was to design communication content. And a really important principle of this mental models approach is not to overload the communication again with what experts think people should know, and instead really just to focus on the things that were revealed through the surveys and interviews that actually influence people's decision making. And so this was a postcard that we designed. Part of our survey actually asked people how they would like to receive information about water testing. And a postcard by mail was actually the most popular option in this particular group. So this was an oversized colored postcard, kind of like one that you might get in the mail as part of an advertising campaign. But its design, again, was to counter these misperceptions about water testing. So one misperception, again, was this misconception that you should be able to see, taste, or smell contaminants in your water. The second factor had to do with kind of knowledge and urgency. And so we tried to promote a sense of urgency with this messaging: time to test your well, it's time. People were worried that they didn't know how to do it. Again, that's related to the knowledge and urgency factor, and also didn't know what to test for. So, we tried to allay their concerns by providing information. This is the backside of the postcard, providing information about the recommended testing schedule, and then also to address concerns that people had that they wouldn't know what to do if water is contaminated. Again, this is the knowledge and urgency factor. And I was fortunate enough that one of my students at the time was the basically private well specialist for the state health department, and was willing for us to provide his phone number. So we were able to provide a phone number. And then the next step was to test whether this worked. Now you might notice that there's one of the key factors: worry about costs. We didn't say anything about costs in this communication. If you look back at the front of the postcard, there was nothing about costs here. There's nothing about costs here. And why that was is that we wanted to separate the effect of concern about costs with the effect of these other factors: the lack of knowledge and sense of urgency, and this misperception about being able to see, smell, or taste contaminants. So we designed our test to separate those things, and we implemented a randomized control trial where there were basically 4 different groups. So two groups received the risk communication postcard. They received the postcards with all of the content that I just showed you. Now, half of this group approximately just received that risk communication content, nothing else. One half of it, there was extra messaging on the card that said, we're providing free water tests, and provided a phone number for my research group and also an online enrollment link for those who wanted a free water test. So half of this risk communication group got a risk communication that came with a free test offer bundled on the same postcard. The other half just got the communication. There was another group that got a free water test. And so one of these groups got only a free water test with no risk content at all, none of the risk information on it. And then there was a control group that didn't get anything. And we surveyed all of these people several weeks after we mailed out these postcards. So this is what the postcard looked like for those who only got the free test offer. There was an address on one side, and then this information about free tests, and that's it, none of the risk messaging. The group that got the risk communication and the free test got a version of the postcard that had this plus all of the information content. And then we looked at 4 outcomes. Again, we mailed out surveys a few weeks after, and then repeat surveys again. And we asked the question, has your water been tested since June 11th? I believe we mailed out the postcards on June 11th of 2018, roughly. And then this follow-up question was therefore asked several weeks later. And then we asked these questions that elicited the strength of their beliefs about being able to see, taste, or smell contaminants, their kind of lack of confidence in knowing how to get a water test and sense of urgency about testing, and their worries about costs. So we looked at all of these things. And now what did we find? So we did find that the risk communication and free tests together were very effective in motivating people to get a water test. So what this is showing, it's the result of a statistical analysis where we compared the 4 different groups. So this is comparing the groups that got only the risk communication, the group that got only the free test, and the group that got the risk communication and free test against the control group. And when you compare this risk communication and free test to the control group, this group was basically 13 times more likely than the control group that didn't get anything from us to say they had actually gotten a water test since June 11th. The effect of the risk communication alone and the free test alone, interestingly, neither one of these was statistically significant. So providing just the information without addressing cost concerns wasn't enough to motivate people to get a water test. Providing just the free test without the communication content about why it was important to take advantage of this free test also wasn't effective. So that was an interesting finding. One problem we found is that a lot of people really didn't remember receiving our postcards. So we controlled for that in our statistical analysis, but this basically chart shows among the 4 different groups, what percentage remembered that they received a postcard at all. So this first group here in red basically didn't get anything from us. This group in green got a free test offer. This second group in red got the risk communication, and this group in green got the risk communication and free test. And so we asked whether folks remembered getting a postcard specifically from the university and whether they recalled getting any postcard at all. And a lot more folks, basically some folks recalled that they got that a university was the source of the postcard. Others recalled getting a postcard but didn't remember where it was from. But what the important message is here is that even in the group that got the risk communication and the free test right here, only about half of them remembered getting anything in the mail about well water testing. So this suggested to us that, we sent out this postcard just once. We had a limited budget for this project, but I hypothesized that if this postcard were sent out multiple times and perhaps also matched with some other messaging methods, maybe public service ads or other messaging with the same content, that it might be even more effective because people, basically would then be more likely to receive the message. So that's something that would need to be tested. A really interesting thing is we're not fully sure why the risk communication and free test worked, because again, if you go back to initially, we had developed this diagram that suggests that when people basically are more concerned or don't feel they know how to get a test and they don't feel it's very urgent, they're more concerned about costs and therefore less likely to get a test. So we wanted to see, did the communication influence these factors that seem to influence people's behavior around water testing? And this is a little bit hard to interpret, but basically these are our 4 experimental groups. The control, these are the people that got only a free test. This is the risk communication only group. And this is the group that got both. And this is the sense of agreement with respondents about that they really didn't know how to get a water test and they didn't think it was too important. So what we want to do ideally is for the risk communication to make these scores lower. We want them to be lower than in the control group. So the lower these scores are, the better. What was interesting is that the risk communication alone did have the intended effect. It did decrease this feeling that folks didn't know how to get a water test. And it did increase the sense of urgency. But then when you added in the free test, it seemed to offset these benefits. But again, it was these 2 things together that were needed to actually induce people to get a test. So we don't really know why that is. Similarly, the effects on concern about costs were very similar to the effects on concern about knowledge. We want people to be less concerned about costs. So again, here's the control group. You can see that concern about cost was pretty high. This is kind of the midpoint where people say, well, they're not neither agree nor disagree with statements about being the costs are too much. So we want this to decrease. And if you look, at the risk communication alone or the free test alone, both of these things decreased concerns about cost, but you put them together and these benefits are offset, and yet people got a test anyway. So we really don't understand this. There were no effects at all on this misperception about being able to detect contaminants through sensory perception. Again, we want this score to decrease, and we didn't see that happening at all. So that's kind of a sticky belief that people have, and our effort to counter it didn't work. So we need to try some other messaging to basically undo that misperception about being able to see, smell, or taste contaminants. Now, there were some important limitations of our study that I wanted to point out, which is that there are other groups that circulate information about private water testing, and some of these materials were circulating at the same time as our randomized control trials. So for example, part of our survey population was located in Wake County, North Carolina, and Wake County was circulating door hangers in some areas, trying to encourage people to get a water test. And this is what these door hangers look like. And of course, companies like Culligan often send out offers for free tests to try to sell their products, their water softeners and other products. But what we did test for this, we actually controlled for whether people remembered receiving these other kinds of mailers in our analysis. And these were not really, these weren't associated with any of our findings. So that gives us confidence that, again, it was our specific risk messaging with the free test offer that was making a difference. Also, our response rates were much lower than we wanted. Only about 10% responded to our post-intervention survey. But we did look and see, we were thinking maybe there's some self-selection. Are certain demographic groups more likely to respond than others? And the demographic characteristics didn't differ by treatment groups for the respondents and non-respondents. So again, we're pretty confident in the results. But what are the overall conclusions? First of all, this mental models risk communication with a free water test did appear to motivate people to test their water. The risk communication alone wasn't sufficient, and the free test alone also wasn't sufficient. It was really the pair of those things. Also, we really need to revisit the messaging about how to counter the misperception that water pollutants can be detected through sensory perception. So our attempt to counter that really didn't work. And we think that if we could go and revisit that messaging and try some other strategies, that our risk communication might be even more effective. We also think, because so few people remembered getting the communication, that the messaging might be more effective if it's delivered repeatedly by multiple modes. As I mentioned, maybe multiple postcard mailers, or maybe postcards plus letters, or postcards plus door hangers, or postcards plus public service announcements. And so that's another area for future study. We didn't have the resources for doing that. Social media, of course, would be another one. And with that, I'd like to thank some people. First of all, the North Carolina Water Resources Research Institute, which is funded by the U.S. Geological Survey, the North Carolina Policy Collaboratory, and the EPA, all provided financial support for this work. And I also wanted to especially acknowledge Kennedy Holt, the student working with me, who answered all those phone calls at the North Carolina Division of Public Health. If people are more interested, we actually have 3 articles from the group about this work. This article in the Journal of Environmental Health a couple years ago talked about these semi-structured interviews that we did and what the results were, and it was the cover article. Our survey results to see if we could get at the factors that affect people's decisions to get a private well test. That was published in the journal Science of the Total Environment. And then just a few months ago, most recently, the results on the randomized control trial were published in the journal Risk Analysis. I'm happy to send anybody who contacts me copies of these articles. And with that, I will take questions.
Excellent. Thanks so much, Dr. McDonald. Appreciate that insightful presentation. Just as a reminder to the audience, please drop your questions in the Q&A box. I see that there's a lot of excellent chatter in the chat box, so thank you so much for that. We would prefer that you use either the Q&A box for specific questions, or just raise your hand and make sure that you're able to unmute yourself. Sometimes we've had that happen in the past where folks do raise their hand but are not able to unmute themselves. So if you'd like to speak up, that's totally fine. You can raise your hand, I can unmute you, and you can ask your question that way. Okay, so let's take some questions at this point. I see that we've got 3 questions in the Q&A box. Dr. McDonald, I'll just read them out loud for you and give you an opportunity to respond. All right.
Sure.
So the first question is comes from Sherry Collins. She asks, did having children with risk of affecting health factor in?
That's a really good question. And we did include questions about whether participants had children in that formative survey that we did, and there was no association there, which was kind of counter to our expectation.
Excellent. Thank you. Another question from Elizabeth is, were the results of the free water tests good? I would wonder if folks had good results and it cemented the idea that they don't need testing, or using their other 5 cents, or using their 5 senses was working fine.
Great question. Well, we actually required that people respond to our survey before they got the results of their free water test. And so, that in this case wasn't the issue. But you're right, it may be that if people get a one-time test and it doesn't reveal any contamination, that they might be inclined to think that their water is good forever.
All right, let's allow some folks to talk up here. Crystal Woods, I see that you have your hand up. I am going to unmute you and allow you to talk. And you can unmute yourself and speak up, Crystal. I see that you're muted. All right.
Oh, I'm sorry.
No
I
worries.
did not have a question. Technical difficulties.
Oh, all right, no worries. Thanks, Crystal.
Thank you.
Okay. All right. Let's see. Looks like Leon Vinci has a question. So Leon, I'm going to unmute you.
Good afternoon. Hi, Leon Vinci from Southwest Virginia. So we're in the neighborhood, and we're rural in our area as well when it comes to private well water supplies, et cetera. My experience as a quote unquote old school sanitarian is, of course, one-on-one is the best. And I've actually conducted surveys where we've gone door to door for this kind of effort. And when you're door to door like a salesman, if you've got the free sample, suddenly your percentage participation goes up. So had you thought about a follow-up endeavor along those lines?
That is such a great question. That is really interesting, and that's a fabulous idea for a study. And then another interesting idea would be to see if, when you go door to door, if the type of messaging you use, if it's mental models versus traditional messaging, if that makes a difference. We didn't go door to door. Our idea with this was that if you're dealing with a county health department that's already overwhelmed, and they have thousands and thousands or tens of thousands of wells in the county, that it would be nice if they had something that would kind of relieve the personnel burden, especially for smaller health departments. But that is really an interesting comment. Be fun to try that out.
Great, thanks, Leon. All right, let's take some other questions from the Q&A box. Keith Allen has a question. How much do these water well tests cost the private well owners, since you mentioned cost was a factor on not getting routine testing?
Right, that's a great question. So, the cost of private well testing varies depending on where you get it. In North Carolina, it varies by county. Some counties offer a sliding scale for costs. In Wake County, a first timers package, which includes a panel of tests, basically costs $225. If you want, more comprehensive panels, the costs are higher. But again, different counties charge different amounts. Some have sliding scales, some don't. Private labs, of course, charge different amounts.
Great, thank you. All right, let's allow Daniel Morvan to talk. So Daniel, I'm going to give you permission to speak.
Oh, thank you. And thank you, Dr. Gibson. Can you hear me okay?
Yes.
So I have a couple questions. Was there any work done to kind of determine what was the temperature of the community in general, and maybe what they thought about why they were on wells and on septics when all their neighbors weren't?
That is such a great question. Boy, I'm getting really good research ideas. There was not. What I have found in my wanderings is that awareness of this outside the communities is almost non-existent. Within the communities, it really varies, and people become aware, tend to become aware if there's like a community leader. But yeah, that's a really good question.
Yeah, I mean, that map was very revealing, and I think if it had been shared within the community, it could have been impactful, just to give people some gauge of what's happening or how it all looks in the larger picture.
Well, I'll tell you what usually happens is, even when the communities do become aware and advocate for decades, there can be a lot of resistance.
Oh, for sure. Yeah.
Yeah. And so
it's just interesting to see, like just having that visual.
It is. And that community, I actually have a good story for that one, which is that they actually, because of the work we were doing, we had sent mailers to people asking if they wanted their water to be tested. This is before we started the risk communication work. And one of the residents contacted me and said he'd been lobbying the town for more than a decade to try to get water extended into his neighborhood, because they had actually water quantity problems as well. The wells were running dry, a number of them. And so a lot of the homes didn't even have enough water flow for things like, running a washing machine or having a reliable shower. And so we actually, were able to get a team of folks from the university and some civil rights lawyers to go to the town. And the town actually turned out to, once we had this large group assembled, to be willing to meet with us. And the community in May of 2020 finally got water service. Their wastewater issues are still not resolved though. And that's going to be a more costly proposition for the town. So anyway, there was a good news story there, but other of these communities, really, some of them lobby for decades.
Right. Yeah. I mean, I just seeing that map was very revealing. So maybe that's something worthwhile. The other thing I was curious about is, for the people that said that they were relying on sensory perception, were there any follow-up questions to see if really that was a cover-up for being concerned about cost? Like, maybe another question like, oh, so if cost was no issue, would you be interested in getting your well tested?
Yeah. Well, if you look at my kind of decision-making model, we did test to see if the concerns about cost were related to those sensory perception questions, and it turned out that they weren't. So even people with means actually can tend to have that same misperception, which is interesting.
Yeah, that is interesting. I was kind of curious about that. The other thing that stood out to me is that the messaging wasn't particularly outcome-based. It didn't really provide people with anything. It wasn't like written in such a way of like, let's do this so we can get the information to do this. It was just like, it read like, oh, we're just going to be collecting information, and this is something you might want to know, as opposed to, maybe giving people some real reason for why it would be worthwhile for them to do it, to not only do it, but to do it now.
Well, here's the crazy thing. In our survey, we had assumed, we went in with the advanced assumption that if people were only more aware of the potential health risks of well water contamination, they'd be more likely to test their water. And in our analyses, maybe it was just our population, but concern about health risks was not related in any
Right.
way. Yeah.
Well, and I not so much health risk, but the promise of like, we're going to be able to do something about these health risks.
Oh, right. Yeah. That was on the postcard. That's where, if you wanted, you could get the free consultation. And there was messaging about it, there being easy solutions, easy low-cost solutions. That was included on there. But maybe the messaging could be made more effective.
Yeah, because even easy low-cost solutions, it doesn't really give me the impression that if I tested my well water and it was filled with bacteria and heavy metals, that I would be able to do anything about it. It just seems like it seems like there was really not a solution for people that might end up being in a circumstance where they are struggling with having contaminated groundwater.
Yeah, it could be. So that would be something, again, though, the idea with this mental models approach is you really have to test your messaging rather than just a priori assuming you know what people need. I was just going to go back to the postcard. Let's see. Show you the messaging that we did have about, it was on the back side. Yeah, what if the testing finds a problem? Maybe you're right, though, this could be optimized.
And maybe even if it was something was communicated about what the long-term goal is, like we would love to get this information because we want to advocate for.
I see, for these particular communities, that could be.
Yeah, because then I think that's a little bit more energizing. It's a little more activating than just, if you are contaminated, then you can get a free consultation.
Right.
To maybe get something that you can't afford,
Right.
Well, thank you. That's such great work. I'm excited to continue to hear about how you support these communities that are based on wells.
Thank you.
Yeah, thank you.
Thanks, Daniel. And folks, I see the time. It's 1 o'clock. We're here in Eastern time. So we're out of time for this webinar. I just want to quickly wrap things up here. I want to thank, of course, Jackie, who took out time from her busy schedule to share the details of the study with us. I want to thank all the attendees for participating in the discussion, asking excellent questions. As a reminder, I am dropping a couple of links in the chat here. One of them is the one that I promised earlier. It's a link to the online community, as well as the PWN survey. If you are curious and would like to check out more about the private water network, I encourage you to check out both of those links, which are now in the chat. And last reminder, of course, as you X out of this webinar, the survey for this webinar series will pop up. Please do give us your feedback because it does help us in planning for future content. With that, Jackie, thanks so much. Excellent presentation, learned so much. And thank you everybody for attending the first part of this webinar series. Our second webinar is also this afternoon, accidentally. It's at 2 p.m. So hopefully I can see a lot of you folks again today at 2 p.m. With that, I'll sign off and just want to thank everyone for being part of this webinar. Thank you so much.
Thank you.
Mm-hmm.
Okay, I hope you feel better.
Thanks, Jackie. Appreciate it. Take care. Bye-bye.